Hey guys, can you hear me?
Yes, brother, how are you?
I'm fine, Mahmoud. How are you?
Yes, fine, all is good.
Okay. Sorry, I'm joining a little bit late. I had to extend into our time with the other class because since some of them they actually came late, so we had to do a push forward a bit, like 10 minutes.
Okay, no issue, thank you.
So, what we were talking about today? Can we all have access to the classroom, or have to share my screen as well? Let me just share my screen in this case. Okay. I hope we can all see my screen right now.
Yes,
Okay, good, excellent. So today we'll be talking about, we'll be looking into pharmacology, okay? And we just have a run through like a crash course on it from medication administration, right? From the routes of administration, absorption, and elimination, right? So we're looking at pharmacokinetics, pharmacodynamics, all of that. And then we'll look at some high risk medications and monitoring as well. So with medication administration, we have to pay attention to the routes of administration. We know we have the oral routes, right? The IV routes, which these routes they pay. I mean, they're very important because every route determines how fast the medication is being absorbed into the body. For example, with the IV route, this is the fastest, and since the medication is delivered directly into the bloodstream, it can exert an immediate effect. Okay, and the next we have the oral. So generally, we know this is the most common route, but it's slow because it needs to go through the GI tract, and potentially it has to go to the first bypass effect, where the liver actually breaks down the medication and reduces its bioavailability before it reaches before it enters circulation and reaches its intended site. Then we have the enteric coded tablets. This it's very slow because the medications are often coded or designed to delay the absorption until they reach less acidic environment, right? And we all know it's never advisable, or it's often said you should never crush an enteric coded medication during administration, right? Or a capsule as well. Are we following?
yes, yes,
Okay. So beyond the administration route, like there are two factors that influence drug absorption. And we have blood flow to the site and the medication form. You know, a site that's highly vascularized, it will promote fast absorption and transportation to its intended site. So the effect of medication there are felt almost immediately, right? The faster a medication gets into the bloodstream, the faster it exerts its effect, right? And another factor that influences we have the medication form. Like we said earlier, enteric coded. I mean, they are they're designed like to slow the absorption to the rich, less acidic environment like the intestines, right? And looking at the metabolism, how the body processes the medication, the primary organ is the liver, right? So we have to pay attention to the liver function. If you have a patient with liver cirrhosis, this will affect the metabolism. Since or if the patient cannot metabolize the medication or clear out subsequently or immediately, it can lead to build up of the medication leading to toxicity. Okay. So looking at the half-life and the elimination, how the medication exits. So, the half-life of medication, like that's the time for 50% of the drug to eliminated from the body. So the knowledge of the half-life, it helps us with the dosing. How often or how frequent we should increase the dose or give another dose, right? So if a medication is given and the half-life is like in 30 minutes, after 30 minutes, what do? We need to give to maintain the steady state, right? Depending on the dose. That's just practically what they're talking about here in the half-life. So now let's look at how the medication, the exit effects. So on this, we have intended actions versus unintended effects of medications. We'll be looking at side effects, adverse effects, and the toxic effect like toxicity. I don't know if someone can help with the difference between the three, the difference between side effects, toxic effects, and the adverse effects. Can we have someone help us with the difference? So with side effects are like they're often predictable secondary effects of a drug, right? At a normal dose. We have, for example, nausea, right? Just a side effects. Let's take, for example, a case of an ACE inhibitor like captopril. The side effects, we have coughing, right? That's a side effect. But with the adverse effect now, sorry, this is harmful undesirable effects, right, of a medication occurring at the normal dose. Let's take another example. Like let's take the same example for the ACE inhibitor, captopril. Like we said earlier, the side effects, we have coughing, but the adverse effect now we have angioedema, right? This is a huge safety concern. Swelling of face, tongue, which can compromise the airways, right? Just like the adverse effect. The medication is given in a normal dose, but it still exerts these effects. And with the toxic effects, toxicity, like this is directly linked to the dose of the medication. The medication given in a dose that the body cannot actually handle, or accumulation of a dose of medication in the body causing a toxic effect, right? Like we talked the other day or our previous class on the hypermagnesemia, which probably lead to respiratory depression. Like magnesium toxicity will lead to respiratory depression. Okay. Guys, are we following? So here we have critical signs of adverse effects to watch for. Like we have opioids, and it's stated you have to be vigilant for respiratory depression, right? This is an adverse effect, okay? Like let's say the difference between uh, respiratory depression and constipation. Respiratory depression and constipation, these are all effects of, they are all effects associated with opioid medications, but one is an adverse effect and another is what? Side effects. Okay, like respiratory depression is an adverse effect, constipation is just a side effect. Okay. So another we have digoxin, which is a cardiac glycoside. And the key sign of toxicity here, we have vision changes. The patient may report seeing yellow halos around light, which requires like immediate intervention. Then another we have the ACE inhibitor. Like I said earlier, you have to watch for angioedema, like rapid swelling of the lips and the face, right? Which probably leads to, compromising of the airways, airway obstruction. Another we have antibiotics, right? And you have anaphylactic reactions, which will cause symptoms like wheezing, shortness of breath. So once this is noticed, once these are noticed associated with the medications, you stop immediately. Another medication we have with warfarin, right? And you often see signs of bleeding, such as black tarry stools, right? Strong coffee ground emesis, which are indication of GI bleeding. Okay.
I'm sorry, Mr. Virginan. We should begin now or after 30 minutes?
Sorry.
We should begin now. It's يعني plus it's now the time or what? Which time we should begin? Because
Yes, yes. Like we should begin, right? Like we already in class. Am I going too fast?
هو احنا يا جماعة مش بنبدأ 9:30 9:30 ولا 8:30؟
النهارده بعته 7:30.
أصل في ناس كتيرة مش موجودة، موجود 6
أيوة
بس.
إحنا بدأنا 5 يعني إحنا عددنا دلوقتي 10 حاليا. مش عارف هم غيروا الميعاد ولا إيه.
بادئين بقالكم ياما؟
إلا تلت.
بادئين بقالكم نص ساعة وتلت ساعة؟
إلا تلت هو بادئ 8 إلا تلت. والله
Because Mr. Virginan, I think not everyone aware about this time because we now okay, let's continue. But I'm just telling.
Okay. No, you can go on, Ahmed. The timing is not convenient.
I can. We have group actually. I can send them now on group.
Oh, okay, okay. Like not everyone is available in class right now.
Give me 1 minute. 1 minute.
Okay. I think after Ramadan, from next week, we probably have a steady time which can suit everybody, right?
Yes, yes. It will be different than now.
Yes, yes.
Okay, Mr. Virgin, I send it to them on the group already. They will come now.
Okay, okay. Thank you very much. So let's take a look at the golden rules for safe medication administration. I hope we can all recall our 5 rights of medication administration. Always, like, you check the right route, right? We recall the 5 R's, right? Right route, right time, right patient, right dose, right? Right medication. Right?
Right dose, right medication, right route.
Yes. Right time.
Yes.
Yes. Good. So our our safety checklist as LPNs or RNs as well, you always have to verify the order. Okay, you verify the order must be complete, right? Like, it's your responsibility to question any order that you don't understand or a missing dose. Don't just carry out an order without understanding it, or if you notice any discrepancy, you should always clarify before administering, right? To prevent medication or serious errors. Another safety checklist you have is you use 2 patients identifiers. Like, when administering a medication, right? You check, like, the date of birth with the name of the patient or the ID, right? Then looking for that, you double check high alert medications. With high alert medications, you always double check with another nurse independently before administering. Okay. So last on the checklist, you assess the patient. Like, certain medication, they require physical assessments. Like, you have the digoxin. You need to assess for the epical pulse. It should not be less than 60 beats per minute. If it's less than 60 beats per minute, you notify the provider. You don't go ahead to administer. Okay. With antihypertensive, you must assess the blood pressure before administering the medication, which is the standard protocol. So during the administration process, you might encounter situations like the patient refuse the medication. When a patient refuses the medication, we know the patient has the right to refuse treatment. So we respect the patient's autonomy. Okay. So we respect the patient's autonomy, we document the refuser, and we inform the provider. That is very, very important. Okay. So, and as well, a patient might ask a question like they don't understand why they are being given the medication, or the medication might seem off as compared to what they have been given before. So you don't ignore a patient's question during medication administration. I mean, it's your duty to stop, you recheck the order, and you verify with the pharmacy if it's necessary before administering the medication. Okay. This actually help boost the patient's morale, like the patient is being involved in his or her own care. So looking at medication error, So in case of a medication error, what is the priority action? First, you stop, right? You assess the patient for adverse effects, right? Then you notify the provider immediately, correct? In that order, correct? You stop, and then you assess and monitor the patient for adverse effects, and you notify the provider. After you have notified the provider, what do? You complete the incident report. You write the incident report, and you should bear in mind that this incident report it is not meant to penalize or punish you. It's meant to like enhance patient safety in the future as well.
Excuse me, is this material available or not?
It's available in the classroom.
Okay, thank you.
Okay.
Sorry, we still didn't receive this material today. Maybe I don't know. Maybe tomorrow they will send or not. I don't know.
Okay, you guys have not received this material.
Yes,
Pharmacology.
yes. Me too. Not received.
No, we didn't receive it.
Okay. Oh, I'm really sorry for that. I think I'll check in with the team about that. And I think after the class, probably after the class, I'll just have to send. I might even have to send it like individual emails to everyone. Okay.
Okay, thank you.
Sure. So in case of like we're talking, in case of a medication error, you assess and monitor for adverse effects, right? You notify the provider, and immediately after, you write your incident report. Okay. So since we've had a crash, like a run through on this, we will look at some high alert medications. Some high alert medications that need close monitoring during administration or even after administration. So, with high alert medications, like these are drugs that they carry a high risk of causing, significant patient harm if an error occurs, right? So we should like monitor closely during administration, like or even after administration. You analyze the risk and get strategies to correct or reduce the damages being done by the medication if they occur. So first up, we look at the foundational principles of medication safety. We just said, we just made mention of the fact that you have to double check high alert medications, right? In administering high alert medications, what do? You always double check independently with another nurse. Okay. It's one of the core safety verifications and actions in handling high alert medications. And as well, you do verify the rights of administration. Like you said, the 5 R's: right patient, right drug, right dose, right route, right time. You should never forget that. Okay. So another core safety verification we have, we made mentions of nearly all these things earlier. Like you use the two patient identifiers, right? Like the name of birth, the name of the patient, and the date of birth, right? Or on the medication administration record. So in verification, like I said earlier, you question incomplete or orders that you don't understand, orders that seem incomplete or out of the ordinary. It's within your right to question the orders because you are the first line of defense for the patient. Like you are advocating. You're advocating for the patient's safety as well, right? So it's within your right to question incomplete or orders you don't understand. So during the medication administration, you have patient refuser, right? Patient questions like we mentioned earlier with the patient refuser. What do you do? Guys, what do you do when a patient refuses treatment?
Yeah, respect the patient because patient it's autonomy. It's his rights to refuse
Okay,
medication and inform notify the doctor.
good. So, like I said, you're absolutely correct. In the course of medication refusal, you respect the patient's autonomy, right? You document the refusal and you notify the provider or the doctor, like you said, or the RN. Okay. In the case of the patient's question, you should uh, you should never say things you don't understand, right? Like it's not within your scope to do patient teaching. So if the patient is asking of you something you don't understand, it's I mean you should never be ashamed or like feel sad to refer to the provider. Okay, but if the patient is making note of something like we said earlier, the medication it's not like what the patient used to take at first, so he or she is questioning it. You stop, right? You verify the order, right? Then you check with the pharmacy. So now look at the error discovery. So in case of medication errors, what do you do? You assess, right? You assess for adverse effects and you notify the provider immediately. And after that, what do? You complete or you write the incident report. This will help improve safety. Like we said earlier, it is not meant to penalize or punish you. It's meant to improve safety and prevent other errors like this to occur in the future. Okay. So now let's look at some high-profile medications. With these medications, like we said earlier, these are drugs that they carry a very high significant risk during administration. Like if an error occurs, it might be fatal. So it needs close and consistent monitoring. The first on our list will be opioids analgesics. You know, these are used in treating severe, like moderate to severe pain. But it's actually a high risk medication because there's a thin line between the like toxic dose and the therapeutic dose. Can someone give us a difference of what they understand by the therapeutic dose and toxic dose of a medication? Toxic dose and therapeutic dose, please. So with toxic dose, this is the dose required to achieve a desired effect. Like with that's therapeutic dose, sorry. With therapeutic dose, this is a dose required to achieve the desired effect of medication administration, right? So once you exceed that that dose, you accumulate into the body and it becomes toxic. Okay. So a medication like morphine, which is an opioid analgesic, during administration, you need to assess for what? Respiratory rate, because the morphine is a central nervous system and respiratory, a central nervous system depressant. And like we talked about it last week in our last class, like same as magnesium sulfate, when administering such medication, what do you monitor? The respiratory rate, right? You monitor the respiratory rate, the level of consciousness, and the pain score. Okay. In the respiratory rate, signs of toxicity or overdose, they're often associated with respiration and shallow breathing at rates of 8, right? 8 or below. That's indication of overdose or toxicity. So with this, what do? You prepare. What do you do? Prepare
For toxicity of morphine,
yes.
we will put oxygen support to the patient and we'll give an antidote and monitor vital patient.
Okay, like you said, you monitor the vital, especially the respiratory rate. So in case of toxicity, you notify the provider and prepare for administration of antidote, naloxone, right? Naloxone or Narcan, naloxone, the antidote for opioids, analgesics. Okay.
Yes.
And like I said earlier, you monitor for level of consciousness and sedation as well. And the pain score, since the medication is meant to treat moderate to severe pain, you assess the pain score. You check if the medication is attaining its desired effects, like it's relieving the pain, or it's not, like, or the dose is not enough to relieve the pain. So looking at the side effects of morphines, you have side effects of morphines or opioid analgesics. You have the common side effects like constipation, okay, which is as a result of slow gastric motility, since it's a depressant, right? And in an emergency, once you notice respirations of 8 beats per minute, it's an indication of naloxone, or it's an indication of morphine or opioid toxicity, which is a very serious and life-threatening situation. So you notify the provider immediately, right, and prepare for the administration of naloxone, which is the antidote. And another high-risk medication we're looking at will be anticoagulants. For example, you have the warfarin and heparin. So can someone help us with the difference between the two, warfarin and heparin? The difference between warfarin and heparin.
Yes, we give heparin and warfarin infusion for patient. Patient has pulmonary embolism or something, patient will go on infusion on heparin, or he will take as therapeutic doses like BID or something like this.
For heparin, this is a fast-acting anticoagulant. We can
Good,
give it IV or subcutaneous,
good,
while warfarin is an oral anticoagulant.
excellent. That's excellent. Like you said, heparin is a fast-acting anticoagulant. It's given IV or subcute, right? And
Yes,
heparin and warfarin. Sorry, warfarin. It's oral, and it has a slow or long time to exert its effect. Okay,
yes,
so these are often given like in events. So when administering this medication, you need to closely monitor like signs of excessive bleeding or trauma as well in the patient, right? In case you give anticoagulants while the patient is bleeding, you have a risk of the patient is running the risk of hemorrhage, right? So it's important to assess if the patient is actively bleeding or the patient has unusual bruisings, right? You check for bleeding gums, right? Those are the assessments before administration. You also check for black tarry stools, which are indication of what? GI bleeding. As well, you check for coffee ground emesis. If the patient has coffee ground emesis like vomit, those are indication of GI bleeding. So you cannot administer anticoagulants during an active bleeding, right? And with heparin, can someone help us with the antidote? The antidote of heparin and warfarin.
I think for heparin is protamine sulfate.
You're right, correct. Protamine sulfate for heparin and warfarin,
فيتامين كي.
correct. Warfarin, vitamin K. So warfarin is used, like Mahmoud said earlier, it's used in long term and it's taken orally. So with this, when taking this, it's often you have to monitor the INR, like the international normalization ratio, right? Which is like the INR. It just it measures like the blood clotting time, the time it takes for your blood to clot. Okay, and you have values of like 2 to 3, which are normal, which are normal ranges. So if you have like values of 4, it shows that your blood takes longer, like 4 times longer to clot. So you cannot administer warfarin. Okay, and in administering these medications, you need to always pay attention because when taken with non-steroidal anti-inflammatory drugs and aspirin, what do they do? It can lead to bleeding. You have a risk of bleeding. Okay.
Okay.
Yes. So with heparin, like you earlier said, heparin it's mostly given IV or subcute, and it's fast-acting anticoagulant. So during administration or before administration, you're supposed to monitor the what? The APTT, right? Activated partial thromboplastic time. Okay. And like you said, the antidote, vitamin sulfate. Okay. Now we'll look at insulin, which is another high-risk medication. So with insulin, we know it's given to correct glucose metabolism, right? In diabetes, diabetes is an error of glucose metabolism. So your body cannot metabolize glucose correctly. So yeah, you're given insulin. Okay. So it's a high alert medication, right? And its administration must be monitored in order to avoid complications like hypoglycemia. Because like the number one cause of hypoglycemia in diabetic patients is often associated with over medication. When you over medicate a diabetic patient, they tend to be hypoglycemic, right? So in terms of medication administration and risk management of insulin, you need to pay attention to the timing. The timing is very essential when administering insulin. And looking at rapid-acting insulin like insulin Lispro, right? We need to pay attention to the onset, the duration, and the peak. Okay, like all this information, it helps us. It helps us know or understand when to administer a medication, right? Fast-acting insulin, like Lispro, they are supposed to be administered with food, alongside with food, right? To avoid or like to avoid hypoglycemia. Okay. And talking about hypoglycemia, symptoms of hypoglycemia are often associated with sweating, tremors, right? So if you have a patient exhibiting like the signs of hypoglycemia, what will be the priority nurse intervention? The priority nurse intervention for a patient expressing symptoms of hypoglycemia. So the priority nurse intervention, that would be to administer fast-acting carbohydrates, right? Like orange juice or glucose tablets, okay? Which is intended to raise the sugar level, right? So our next list on the high priority medications, we have digoxin, which is a cardiac glycoside, and it's used to treat myocardial contractibility in conditions like heart failure. Okay, and it has a very narrow therapeutic window of like 0.6 to 1.2. So it's supposed to be like the measurement is supposed to be near accurate, and assessment it's a priority always. Okay, like it requires close monitoring all the time. So with digoxin, in case of digoxin toxicity, the patient will often complain of seeing what? Yellow halos around light, right? Visual disturbances. These are classic symptoms of, or classic signs of digoxin toxicity, correct?
Yes, brother.
Okay.
For nausea and vomiting, and halo for the vision, green vision.
Okay, great. So those are like classic signs of digoxin toxicity, like seeing halos around light and say vomiting and the others you mentioned. So having this run through, I'm really sorry, and I don't know you guys. I'm really sorry you guys could not get these materials on time because we are supposed to even look at some few questions today. But regardless, we can still look at them right now and have a run through few questions from the last test we took last week. And I noticed there are some questions some of us could not, like a huge number of us could not get correctly. So we might have to look through it as well. Did you guys get the rationales and the answers to the questions?
Yes,
Yes,
bro,
we
we
get.
can check more, but we have different answer for this one. We are confused for our answer.
Sorry?
We are check rational already since last week for all exam, right?
Yes.
A2 and B2 and pediatric, but we are
Yeah,
confused from this answer.
exactly. That's what I was trying to like. That's what I'm trying to address today as well. So we can take a look at it, right? So let's finish with let's finish with a quiz on what we just discussed, and then we take a look at those questions and the answers of last week.
Okay.
So let's start with question 1. States explain the primary nursing action required before administering a high alert medication and the rationale behind it. The primary nursing action required for administering a high alert medication.
They need double check for high alert medication to prevent the interaction or this high risk medication fatal for the patient for allergy.
Exactly, like you said. Double check with another nurse independently to avoid medication error. Very important. Okay. So looking at question 2, say describe the main purpose of the CMIRPS.
Ensure will provide the safety of the patient and the organization.
Okay. Ensure safety and prevent future medication errors. Okay. Our third on the list is what is a medication's half-life and how does this concept influence medication dosing schedules? And what do we understand by medication's half-life? This is the time taken for the body to eliminate 50%.
Frequency for this medication?
More frequency for doses for short half-life.
Yes. So we all understand the medications half-life, which is the time taken for the body to eliminate 50% of the medication, right? So it helps in the dosing. Like if a medication with this short half-life, you can there'll be frequent dosing, correct?
Yes.
So the fourth question, like, what are the priority assessments a nurse must perform before administering an opioid analgesic like morphine sulfate, and why are they essential?
Respiratory rate, blood
Respiratory rate.
pressure, and pain level.
Consciousness level.
Yeah, exactly. Level of consciousness, respiratory rate, pain scale. Question 6 or question 5, sorry. So explain the signs of digoxin toxicity and the crucial nursing assessment that must be completed before administering this drug.
Yes,
Science.
started
No,
before. Yeah, right. Continue. I'm sorry, Plaza. Continue.
no. Go ahead. No issue.
Signs of the vision for whole of the vision and nausea and vomiting.
Good, excellent. And what is the nursing assessment that must be completed before administering this drug?
Heart rate.
Good. So you check for apical pulse, and what is the range? It should be above
60.
60, right?
Yes.
Yeah, 60 beats per minute. So question 6, describe the most appropriate nursing response if a patient refuses a prescribed medication and the ethical standards this action supports.
Consider the autonomy, respect the
Good.
refusal, provide education and document. After that, we can inform the healthcare provider.
Yeah. So in medication refusal, like you said, you document, right? Reason for refusal, and you notify the provider. Okay. Question 7. Why is it critical for patients to complete the full prescribed course of antibiotics even if they begin to feel better?
Because
Should be continuous course to prevent the recurrence of the infection.
Yes.
Okay, that's a good point, to prevent the occurrence of an infection and as well to prevent antibiotic resistance, correct?
And the treatment failure.
Yes. So antibiotic resistance is a very, very serious case. So even if you're feeling better, it's always advisable, or it's important you complete the regimen, the medication regimen, to completely do away with the bacteria in the system. Question 8. So what is the correct procedure for a nurse to follow after discovering a medication error has occurred?
Ensure patient safety, notify the healthcare provider, and report the error according to the policy.
So first you assess.
Assessment.
You assess. Yes. You assess for adverse effects. Okay. You assess if the error or the medication is causing an adverse effect, right? You document, you notify the provider, and you complete the incident report. Okay.
Okay.
So question 9 states, explain the key differences in the absorption rate between the IV route and the oral route for medication administration.
For IV, it's a direct to bloodstream, so it becomes fast and complete absorption.
Good.
Yes,
So
it's
it
the
reaches
faster for IP.
Yes. So it reaches its target, it exerts its effects
Within 30 minutes, I
fast.
think.
Sorry?
within 30 minutes for absorption for IV. The faster
Yes.
for more than oral.
Correct. So the last question, so what are the signs of hypoglycemia in a patient taking insulin, and what is the immediate nursing action?
Yeah.
Shaking, tremor,
Okay, sweating,
tachycardia.
tremors, and the immediate nursing action.
According to
fast
patient
acting.
condition, conscious or not,
Yes, if the patient is conscious,
Give fast
we give
acting
him oral
carbohydrates.
acting carbohydrate.
okay, and if the patient is unconscious,
carbohydrate and glucose. Yeah. If unconscious, give him. If the patient unconscious, we can give him dextrose 50
okay, or
or IM glycogen for pediatric.
exactly. So we know that won't be within the LPN, right?
Sorry?
Sorry. What is it? Sorry, brother.
That
Sorry, say again.
that won't be advisable unless you have been given the proper education and training, right?
We cannot hear. Sorry again.
I'm saying that won't all the interventions you mentioned, right? It's correct.
Right?
Yes,
It's okay.
it's correct. But then, as an LPN, right, when you are given appropriate training, you can carry that out. Okay.
Mm.
Yes. So that will be it for what we're looking into pharmacology today. And now let's take a look at the questions from our previous exam. I think it really, we had some few questions there that quite a few number of us could not get correctly, so we can discuss on it, right? Let's take a look. Let's start with assessment 1. I think, did we receive the assessment and the rationales?
Yeah, we are received an email
Okay.
last room.
Okay. So can we discuss them right now?
It's okay. You can start.
Okay. So I notice question 5. This is 2B. So, let me see. Look at question 5. Yeah, question 5 states a client asks the nurse to explain a surgical procedure. The nurse should.
We cannot see, brother.
Oh, sorry. Let me. Can you guys see the screen now?
Yeah, it's okay.
Okay. Looking at question 5. So the client asks the nurse to explain a surgical procedure. The nurse should, first option we have, describe the risk and benefits, the risk, benefits, and alternative. The second option, tell the client to ask the surgeon. Third option, provide only risk. And the fourth option, provide only general information. I notice most of us could not get this one correctly.
Number 2, tell the client to ask the surgeon.
Exactly. So we have a good reason for it. What's our rationale for that?
Yeah, because only the surgeon have privilege for the surgical procedure.
Exactly. Only the surgeon can do the education, the teachings, right?
Yeah.
Yes. And question 21. Yeah. So a nurse restrains a confused patient without an order. So this is A, battery, B, forced imprisonment, C, negligence,
two.
D, assault.
So,
This false imprisonment.
Forced imprisonment. Good, good. So these are the two, I think these are the two questions I noticed some people did get wrongly. Do we have some other questions in some other forms as well? Like the second assessment or the third assessment?
Someone what?
What you said, Yabash?
I'm asking if we have some other questions that we cannot get a good reason why the right answer was the right answer.
Because it's the right answer.
I'm asking if do we have any other questions during the assessment that we could not understand why, or we could not get a good answer, the correct answer for it, that needs re-verification.
We can collect, maybe next lecture or next meeting, we can collect our questions and tell you about it. But right now, I think we're not prepared to share with you any question.
Okay. So that will be it for today. I think we'll have to see you guys next week, and I think from next week we'll have a good timing where all of us can attend conveniently, right?
Maybe next week it will be our Eid.
Yes, that's something. Maybe next week will be all right, because from then I'll have to talk with the team so we can get a good timing. I mean, which time which time can we generally suggest it will be good for us to meet from next week?
I think this time is good, yeah.
Okay, this time will be good as well.
Yeah, it's okay.
Okay.
After Ramadan, this time is good, I think.
Okay, no problem.
Thank you, boss.
Okay, so see you guys next week.
Thank you.
Thank you, Virgin. See you. Bye bye.
Bye bye.